Did you know that even if your bones feel fine, you may be well on your way of developing osteoporosis? If you want to know more about what to look for and how to strengthen your bones, subscribe to my channel. Hi, I'm Dr. Jake, and my videos provide fitness facts based on peer-reviewed research, but broken down to information that's easily understood and simply applied. For example, here's a question about such a fact. When does bone loss start? In your 30s, 40s, 50s, or 60s? Leave your answer in the comment section and keep watching to see if you're right. Osteoporosis is known as the silent disease because bone loss occurs without symptoms, causing approximately 2 million fragility or low impact fractures each year in the US and nearly 9 million worldwide. The reason fractures are more likely is because osteoporosis is way out here, 2.5 standard deviations or 2.5 T-scores away from normal healthy bones, which means osteoporosis is not just about porous or weak bones, but weak to the point that they predispose the person to fractures from simple falls or stresses like bending over, lifting, or coughing. The most common fractures occur at the spine, hip, and the wrist, which can be seen with an x-ray. But x-rays aren't sensitive enough to measure bone density. For that, a special piece of equipment is required that uses dual energy x-ray absorptiometry, or DEXA. A DEXA scan is painless and relatively quick that measures bone density with a low dose of radiation. Another option is quantitative ultrasound, which is radiation-free, but it only measures one side at a time, while DEXA, the current gold standard, can measure bone density at multiple sites with one scan. A common misunderstanding is that osteoporosis occurs in just women. It can show up in older men as well. My college physiology professor used to like to joke that there was a time when men never developed osteoporosis because they had to bear all the burdens of the world upon their shoulders. Of course, that's not true, and men do develop osteoporosis with or without burdens because as everyone ages, hormonal changes causes the body to break down bones faster than they're rebuilt. For example, in men, testosterone is essential for maintaining bone mass, but its levels slowly decline with age, thus increasing the risk for osteoporosis, which typically shows up in men at age 65 or older. One reason you don't hear as much about osteoporosis in men as you do in women is because testosterone levels in men slowly decline, rather than sharply drop like estrogen does in women at menopause. Plus, we develop greater bone mass in our teens and 20s, and we don't live as long as women, so we have less time for our bones to weaken, which, come to think about it, is not really a good thing. A less well-known group of people at risk for osteoporosis are those with low body weight or small frames. Since they naturally have smaller skeletons, they also have less bone reserve to tap into when age or disease-related bone loss kicks in. Also, bones adapt and get stronger to mechanical stress. So people with low body weight place less mechanical stress on their bones. This reduces the stimulus for bone remodeling and strengthening. Now, it's not an excuse to gain weight unless you gain muscle, because muscles are known to boost bone density through the release of myokines and growth factors independent of mechanical stress. Back to low body weight. If it's extremely low due to eating disorders or chronic undernutrition, there are likely deficiencies in calcium, vitamin D, and protein, which would contribute to bone weakening early in life. For example, disordered eating with its low nutrients and menstrual dysfunction that lowers estrogen in female athletes who train at high volumes causes low bone density in their 20s. That's equivalent to what's normally seen in the 40s and older. In other words, what's known as the female athlete triad can put women at risk for osteoporosis 20 years earlier due to extreme lifestyle choices. And that's concerning because women in general are already at a greater risk for osteoporosis. This is because they naturally have smaller bones and reach a lower peak bone mass than men, thus giving them less bone reserve and a weaker defense against age-related bone loss. In women, estrogen plays a key role in maintaining bone density by inhibiting bone resorption. After menopause, women experience a sudden sharp drop in estrogen levels, leading to accelerated bone loss. In fact, women can lose as much as 20% in the first 5 to 7 years post-menopause. There are other medical conditions like rheumatoid arthritis, celiac disease, and hyperthyroidism that also weaken bones. And even medications like corticosteroids, anticonvulsants, and aromatase inhibitors used to treat breast cancer can also weaken bones. But one of the strongest risk factors for osteoporosis is family history. For example, if you have a parent or sibling that has osteoporosis, especially one that's had a hip fracture, your family history risk factor for osteoporosis may be as great as 80%, which is similar to the heredity for IQ. So if your parents gave you a high risk factor for osteoporosis, hopefully they also gave you a high enough IQ to know how to prevent it. And preventing it is what the risk factors I'm going to cover next are all about. You well know that not getting enough calcium or vitamin D is bad for your bones. The calcium is taken taken up by your bones and combine with phosphate to form hydroxyapatite, which provides the hardness and rigidity your bones need to be strong enough to support your body weight. But if elsewhere in your body needs calcium and you're not getting enough in your diet, the calcium in your bones will be resorbed back into the bloodstream and will be made available to the cells of the body that may be low in calcium but depend on it for normal function. But vitamin D is also important because not enough of it means less calcium will get to the bones in the first place. This is because vitamin D helps your body absorb calcium from the gut into the bloodstream. And it also helps regulate bone remodeling, where old weaker bone tissue is replaced with newer strong tissue. If you're deficient in both of these, you can change that quickly by eating plain yogurt outside in the sun. It's also well known that a lack of physical activity leads to weaker bones. This is because with inactivity, there's less mechanical stress to the bones, and therefore a weaker signal to the bone cells that stimulate bone production. But remember that resistance training and weight-bearing exercises provide the strongest signal for building strong bones, which is why you may want to jump rope while eating your yogurt in the sun. That I'd like to see. And maybe not as well known as that smoking's not good for your bones. Nicotine slows production of the osteoblasts, the bone-forming cells, leaving the bones vulnerable to become weaker. Plus, smoking damages blood vessels that would impair blood flow and calcium delivery to the bones. Add to that excessive alcohol use impairs calcium absorption, and you have another lifestyle factor to consider. As you may have noticed, the risk factors for osteoporosis fall into two groups: the non-modifiable risk factors that determine your risk for osteoporosis, and the modifiable risk factors like diet, exercise, and not smoking that you can do right now to lower your risk based on the non-modifiable factors. A quick note: osteoporosis comes in two types. Primary osteoporosis occurs as a natural part of aging and hormonal changes, while secondary osteoporosis is due to an underlying medical condition or medications like glucocorticoids. So how do you know how weak or strong your bones really are? Well, you can't feel your bones weaken as you age, but you may notice a decrease in height, a dowager's hump or kyphosis, and bone fractures, some of which may happen without you even knowing it. This is why it's important to work with your doctor to know for sure. This may start with a fracture risk assessment tool. It estimates your 10-year probability of sustaining a fracture by considering factors like age, sex, height, weight, previous fractures, and family history. The results can also help determine if further tests or treatments are needed. One of those tests may be a DEXA scan that I mentioned earlier. DEXA measures bone mass density of the spine and hip, and then gives you a T-score that compares your bone density to that of a young, healthy adult. Remember, a T-score minus 2.5 or lower indicates osteoporosis. A vertebral fracture assessment may also be necessary if you've lost more than 2 centimeters in height or there is a suspected vertebral fracture. Then, to rule out secondary osteoporosis from things like underlying medical conditions, a comprehensive clinical evaluation, including lab tests, may be done. The important point is that reducing your risk for osteoporosis should ultimately start in your teens and 20s when you're building up your peak bone density. But if those years are behind you, start now to check off those lifestyle factors because bone loss begins in your 30s. Did you get the question right? Good for you. So check off those lifestyle factors now, rather than waiting until you think you're old enough to have osteoporosis, because by then it's too late. Because osteoporosis is not just about frail bones. For example, hip fractures from osteoporosis can raise your mortality rate by 20 to 24% in the first year. This is why osteoporosis is now a leading contributor to death in the elderly. In my next video, I'll give you more information about developing strong bones as I discuss the difference between osteoporosis and osteopenia, and more tips on how to hang on to your bone mineral density. Thanks for listening. And if you learned something new, click subscribe and or like. Thanks. And as always, my answers come from peer-reviewed research.